Good morning. My name is Eleanor Murillo, and I'm the Program Officer at the National Women's Commission. The National Women's Commission is the secretariat for the National Gender Policy and the National Gender-Based Violence Action Plan. And so we provide, the head of the coordinating mechanism as it relates to gender-based violence.
Okay, good morning, Ms. Murillo. I am Ms. Shana Vaccaro, Assistant Librarian at the Port Loyola Public Library. And this morning we are here to gather some information about domestic violence and how it is affecting our community, especially in this time of pandemic. So my first question to you, Ms. Murillo, is what is domestic violence?
Alright, so domestic violence is violence within the home, abuse. And when we talk about in the home, we're talking about husband and wives, common law husband and wives, and even people in relationships, so boyfriend and girlfriends, people who have children together. But our Domestic Violence Act also talk about the elderly, so an elderly parent or even children is also a part of can be a part of domestic violence.
Okay. So what are some of the signs and symptoms we should look for when we are identifying domestic violence?
Oh, wow. There is so much. A lot of times when we talk about domestic violence, people think just the physical hit, beat, and hit with a gun, with objects, with hand, slap, and so on. But domestic violence also include emotional abuse. So making me feel worthless, like I'm nothing, that's also a form of domestic violence if my partner is doing that to me. If the partner continuously curse you out, or a parent to a child, or a child to an elderly parent, curse you, call you all kinds of humiliating names, that's a form of domestic violence as well. In terms of financial abuse, either withholding money from you or taking away your money, that's a part of domestic violence. Sexual abuse, forcing you to have sex, and you may not want to do that. That's also a form of domestic violence. So it comes in many forms, right? We look at emotional, the physical, the verbal, the sexual, the financial abuse, spiritual abuse, not allowing you to go to church. That's a form of domestic violence.
Okay. What are the long-term impact of domestic violence?
There is so much. I mean, broken homes. We see that a lot here in Belize. Broken families, the emotional part of it, stress, fatigue. When we look at health, a person who has been abused, physical health, always have to go to the doctor, especially as it relates to your sexual and reproductive health. Somebody stomping you in your stomach and in your nether regions and so on, or constantly hitting you in your head. So it affects the health of not only the person, the family, but also our society. Having to spend a lot of money on doctors, it affects your work. Because if you are stressed out, if you are going through a form of abuse, you're not sleeping. So even your stress factors, it affects your entire being, your mind, your body, and your spirit. So it does have a greater impact not only on the family, but also our wider society. If you have to take days off because you're all bruised up, bleeding, and so on again, you may lose some monies there for not being at work. So it does have a big impact on the family and our wider society.
With the global pandemic affecting so many lives, do you see a rise in domestic violence?
Oh yeah. In March, just when Corona, we were hearing about Corona and it was not really rampant yet in Belize, we received some documents from the UN partners, and we read those documents. So it shows that studies say that whenever we go through any pandemic or emergencies, there are rises in cases of domestic violence. And when we looked at our data in January, the cases were going up. Between March and April, we saw a decrease in cases of domestic violence. But then remember, between March and April, we had the SOE and so people were at home, and we don't know if people were more loving, more caring, or is it that people felt that the police and the health and all those partners that are responsible for services were not providing that services, but the number came down. But as the country opened up back again after there were no more curfew, we start seeing a rise again in domestic violence. And now we're even seeing a few women getting killed, raped, and so on. So it is alarming, but we are trying to put things in place to ensure that we educate our general public.
Okay. What services are available for families, including children facing domestic violence?
Okay, so if we look at the gender-based violence referral pathway, for children we have the Human Services Department. So any cases of abuse, neglect, they will handle that case. And so they will see through along with the police, or whether it's the family court, if it's before the court, or the magistrate court or Supreme Court. They also provide psychosocial services in terms of counseling for the child and the parents, and other services to ensure that the child gets what the child needs to function, after going through whatever trauma the child has been through. For women and families, you have the Family and Support Services Department, Women and Family Support Services Department here on Albert Street. And they also, it's not just you go and you complain, but they have a well-rounded system to ensure that they help you, the woman and the family, from beginning to the end. So not only with the court services, but also in the where a woman may need somewhere to stay, they ensure that you get in a safe space. In terms of counseling and psychosocial services, other services, maybe some type of job placement, or learn some skill that you can be self-sufficient and help yourself. So it's a well-rounded service. Now the police they are supposed to respond. So whether you call 911 or the regular number, the police should respond to any call as it relates to domestic violence. Help, my neighbor is getting beat, or help me, I'm locked in a room or a closet and I need help. So the police is supposed to respond, whether it's by phone or whether you go there in person. If it's something where they need to refer to one of the other, then they should do that. We also have the healthcare system. So if there's broken bones, if there's blood, the woman has passed out, whatever it is, or the man, because while we know domestic violence affects women 8 out of 10 times more than males, men can also be victims of domestic violence. And so we have the healthcare system. We also have the judiciary. So I'm talking about the courts. Belize City and Punta Gorda have family court, where anybody, an applicant, can go and apply for their protection order and other orders to help them or their children. In the other districts, you have the magistrate court, who act as a family court. So again, you can apply for those same orders through the magistrate court in the other districts. So basically, those are the main government organization entities that should provide services for victims, for survivors of domestic violence.
Okay. My final question: what are some of the effects domestic violence can have on children?
Well, when I think about the poor babies that go through domestic violence, it breaks my heart. I mean, being an educator for so many years and visiting school, I see it and my heart goes out to them. So, children who are abused, they can either get very angry and they themselves lash out, because that's all they know, that's what they see within the home. So when they go to school, that's what they do. Or they can be very passive, very withdrawn. We know that our children who have been victims, survivors of domestic violence, they go through different trauma, very traumatic experience, and so again they are stressed out too. They cannot concentrate in school because they get flashback of what happened in the home, perform poorly if they do not get the kind of guidance and assistance. You have good teachers who are looking at and know their students, who can say something is wrong with with that child and try to refer to get help for that child, then they can work good in the classroom. But those who are just left there, I mean, they're the ones who fall behind in their classroom. So they either become bullies or they become very passive. They are not as active in the classroom. They do not do very well. They have a lot of issues. And studies show as well that those young people, children who witness domestic violence, they themselves become abusers or are abused as they get older. So it is a vicious cycle, and we really need to ensure that we work at the lower level, because we may not be able to change the older heads' minds about domestic violence or any violence of any kind is not right, but we need to start with the younger ones. And so the more we try to teach them that hitting, name calling is never right. It doesn't matter who it is. You don't hit anyone, no one should hit you, and you do not allow people to threaten, to abuse, to harass. You need to tell someone when that has happened to you. So we have a lot of work to do. It's ongoing, and even in 2020 we continue to see and hear the kinds of cases as it relates to domestic violence.
Okay, Miss Maria, thank you for your time. It was a pleasure.
Thank you too. Thank you too, yes. And remember, 16 days is right around the bend, and so again, we're looking forward to amplifying the kind of activities we do to spread awareness and to highlight the kinds of work that we do within all our organization as it relates to domestic violence and gender-based violence, which is a wider umbrella.
Okay, thanks.
Thank you.